cataract refractive surgeon and also is a scientist in imaging and cell molecular biology. So she works with Rohan and me in this lab. So please.
Thank you, sir. Thank you, Shahnaz and team, for having us here. So I'm just going to skip the initial few slides because Rohan has spoken everything about what the multimodal imaging platform has. So how does it help us in role of in Anterion in ICL planning? How does it help us in the pre-op planning? So what do we need is we need the cornea app and the matrix app because it gives us the corneal topography and other parameters which has already been spoken about. What do we do is we take this app, we take the corneal map, we take the keratometry values, we take the wide to wide, we take the anterior chamber depth, and we take the CCT from this map. Then the other map, the metrics app, how do we use it? We need the ACD, so we can manually measure it, otherwise they give us automated also. We also need the pupil diameter, so it helps us in the same, and wide to wide. So if you have a discrepancy when you've measured when you already have a wide to wide and you want to measure it manually, you can do it, because manual measurements are always more accurate than your automated ones. So once you have all these parameters, this is the ICL, the star ICL calculator, the no financial disclosures. You feed in all the parameters here along with your refraction, and here you get what size of the lens you get. So everything you get in one machine. Also, another thing, if you are doing an IPCL or if you are doing ICL also, you need a spur to spur distance, because it helps us in predicting the vault of the ICL, how much vault it will be after the surgery. So that is not one thing which is automated, but you can always manually measure it, and that is what you need for the IPCL calculations, which is by the care group and also by the biotech group also. So once we have all the measurements, the outcomes are more accurate. So this is what you get in the two apps of cornea and the metrics app. So how does it help us in post-op evaluation? Measuring a vault and outcomes are very, very, very important when you see a post-op patient of an ICL. You can always do it on slit lamp, but as now we are moving towards more imaging tools, if you have a quantification of what your vault it is always better. So always a high vault, what helps Anterion helps us in, along with giving the how much the vault is, it also helps us in seeing how the angles are. So if it is a high vault, you can see if the angles are open or not. So you can actually, you don't need to send the patient to your glaucoma department if required, and then take a call, because otherwise it will lead to high angle closure. And if it is a low vault, you need to be very watchful, because if it is a low vault, it can lead to cataractus changes, or your ICL can or IPCL can keep on rotating. So this is also how it helps us in seeing us in the early post op period as well, which you cannot measure it on the slit lamp. Sometimes the low vault cannot be measured. How, as I said, the gold standard is a slit lamp imaging or a CASIA, which is an anterior segment OCT as well. Now we have Anterion. So what we are doing is we are also doing the vault measurement on all the three machines, comparing how the outcomes are. And to our this thing, they both are pretty much comparable, the anterior and the CASIA vault, and there is no statistically significant difference in both the machines on how it measures the vault.